Hey guys, so I just wanted to go through one of these EHR Go charts with you. This is actually one of the patients that you have an assignment for, Gwen Cummings. I think this is the power of the EHR patient. You're supposed to click in and out of some of these tabs, but I wanted to go through some of these tabs with you and kind of show you what's inside of them so you have an idea of what it is that you are looking at, what you're clicking on, those sorts of things. So when you launch a patient's chart, you have the patient's name and their demographic information up top. You'll notice that the date will always be whatever date it is that you are working on. That is so that the date stays current, so your homework will be time-stamped when you do it with the current date. So that's kind of cool. You'll also notice that there's a patient picture there for most of the patients, so that's also cool. And usually you'll land at the overview page. You'll have the patient's name, again, contact information, spoken language, and race and ethnicity information. The recent encounters will be listed there. You will notice that our patient Gwen here was admitted earlier this morning to General Hospital emergency room. She was checked out in stable condition, transferred, and admitted to General Hospital from the emergency room. She was involved in a single-car motor vehicle accident. She was intoxicated, so she was drinking and driving, got in a single-car accident. From the ER, she was admitted to the hospital and had a positive toxicology screen. So she's now in stable condition in General Hospital. And so we can see there what her recent encounter history has been. We can also see that if the patient has any alerts on the overview page, and so here we see that she has, let's click on, oh, this one, they don't click. So on 220, she has a full code alert that is part of her advanced directive. It's an active alert, so she has an advanced directive. If she goes into a full code, she has instructions for what to do for that. She's a fall risk. That's a clinical warning, so she is at risk for fall. So for the duration of the time that she was in the hospital or until she is not a fall risk, she will have a fall risk bracelet on probably, and the nursing staff and the clinical staff at the hospital will be alerted to the fact that she is a fall risk and she will not be allowed out of bed unsupervised. She also has, looks like, no known drug allergies, so that's good. She doesn't have anything that the clinical staff needs to worry about there. She does have aspiration precautions, presumably because of her injuries sustained in the car accident, so that's an active clinical warning there for her as well. So this is a list of injuries or problems that she is currently dealing with. She was involved in this motor vehicle accident, single car. She was intoxicated. She has positive drug toxicology, and she sustained lacerations to her face, arms, and left leg. So this is her current problem list. Again, seen on the overview page. Her list of vital signs, it shows the last two, but if you want to see more of her vital signs, you can click onto vitals from the overview page and see what her vitals have been reading out since her admit time. So you can see that here it is. This is 8 a.m., 10 a.m., noon, 2 o'clock, 4 o'clock, 6 o'clock, and so on. Temperature, pulse, respiration, diastolic, systolic, pulse ox. You can single these out if you want to, if it helps. You can look at the data points if you would like to. You can also see them down here. So you can see that her blood pressure was a little bit elevated at 7:39 p.m. Her temp was a little bit up. Looks like she's developing maybe a little bit of an infection there. Her blood pressure is a little bit elevated. Her pulse ox is dropping, and her her blood pressure and temper are starting to raise. So that would be a marker for potential infection setting in, probably from sustained injury. So that would be something that the clinical staff would maybe begin to watch. Oops. And you can see at her 11:40 a.m. vitals, her temperature was normal, her pulse was normal, her respirations were normal, her blood pressure was normal, her pulse ox was up in decent range. So you can see here, when she was brought in to the emergency room from having sustained the accident, her respirations are 20, so she was breathing quite a bit higher, quite a bit faster. Her blood pressure was elevated. So you can see where her ranges were. Her pain levels on a scale of 1 to 10, she was feeling no pain at noon, and then at 10 p.m. she was up to a level 2 pain, is where she reported her pain being there. You can also measure, we aren't measuring a whole lot of these things here, but you can also, in other patients' charts, especially for pediatrics, measure growth down here in these vitals, this section of the vitals. And for glucose levels, it looks like they did a cap stick on her when she was admitted to the emergency, where she was brought in through emergency, and it was 120. And so then we've got some other things: level of consciousness and orientation, her other assessments down here: skin, abdomen, extremities, psych, all kinds of stuff. So we have all kinds of assessments in this vitals tab. This is where you'll do a lot of work. This is where you will put in all of your vital signs that you do on each other throughout the course. You'll do it in the vitals tab here. So that is the vitals tab. And then we have the lab tab. Let me go down here. So we have labs. So she obviously had a lot of labs ran. Anytime a patient comes into the emergency room, almost anytime the patients come into emergency room, they'll automatically have labs ran. We call them rainbow tubes. I don't know what they call them out here, but where I worked in the emergency room, we called them rainbow tubes. And so we would draw we would draw like 4 or 5 tubes of multiple colors, like a green, a lavender, a red, an SST, which sometimes is a gold or a marble top tube, and so that we would have blood on hand for any labs the doctor ordered afterwards. Oops, sorry, hold on. Hopefully Chico will cooperate and not bark anymore. So you can see that she had arterial blood gases ran. You can see what her values came out as, and then what the reference ranges for normal lab values are. Same thing for her CMP here. You'll note here that there was no value listed for some of these, and it is because they likely weren't ordered, or they didn't order them. And so what probably happened was that this ended up being more of a basic metabolic than a comprehensive metabolic. So her CBC with differential, urinalysis, those sorts of things. Now, you can also get to the labs if you have an assignment where you have to put labs in. You can get to it from the overview by clicking See More, or you can go over here and click on the Labs tab, where you will enter New, and then you will enter lab values here as well, or you will add a test by name, or you will just put in any lab values. So if I give you an assignment that says enter patient whoever's lab values, then this is where you would do that, in these free text boxes. So I'm going to cancel that, And then back over here to the overview. The next box down on the overview from labs is orders. And so these are all of the instructions that the doctors want done for the patient. And so for this patient, you can also click see more or click over here on the orders tab. This patient has a lot of orders because she came in through ER, and so starting at 10:10 a.m. she had a lactated Ringer's bag, which is medication through her IV. She had case management at 1:09, orders for case management, a psych consult, probably because she wrecked her car under the influence, so they want a psych consult. She had lab orders put in for repeated electrolytes, glucose, thiamine, and CBC every 12 hours. She needed scheduled medications for diazepam, thiamine for meds, dextrose, which is her IV bag, lorazepam, capillary glucose tests to be done, so the finger prick done every 4 hours to measure blood glucose, bacitracin, neomycin, polymyxin for her which is Neosporin for her wounds, and then wound care, and then scheduled meds here, dietetics. She is nothing by mouth, ice chips only until she's alert. Once alert, clear liquid diet only is tolerated by the patient. She is only allowed to go to the bathroom with assistance. Vital signs per unit protocol, and then they added another med here, lorazepam, and then they were screening here, and they admitted her to the unit. So you can see what all the orders are for her as she was admitted from the hospital from the emergency room to the unit, and so you can kind of see what orders do. Now, if you wanted to make a new order for her, and sometimes you will do this, we are going to say new order, laboratory, and say I want to be Marcy Bradford today, and I want to also have her order say she told me that she has engaged during the psych eval, it came out that she is engaging in risky sexual behavior, and so we want to have her tested for HIV and once as directed. STI testing, and status active. Now here's the thing, pending patient consent. So psych told us that she may need testing, but you have to have patient's written consent to test for HIV. So a blood draw, STI testing, pending patient consent. So we're going to put that on here, and here if we had anything to upload like a lab order, a lab requisition, then I'm just going to put going to put requisition sent to lab since I can't attach it here. So I'm going to put requisition sent to lab and add. Oops. Oh, I guess I could add one there. But I don't have one ready, so I'm just going to add the comment there and save. And close. So now I have a laboratory order for HIV, gonorrhea, syphilis, but I would be able to upload a completed lab rec for the testing there and have that lab rec put in and uploaded there for availability. So that's kind of how orders work. Back to your overview page after orders, what do you got? Notes. And I put a SOAP note in here already to show you kind of how that looks. And so let me go over here and show you notes. This is a SOAP note that I put in. You're going to actually do a lot of SOAP notes for your assignments. And so SOAP stands for Subjective, Objective, Assessment, and Plan. I only did the S and the O just to kind of give you an idea, plus I wanted to put something in to show you what it's going to look like when you are finished with an assignment and then download it and save it to your assignment thing here. So, but to add a note, if I wanted to go ahead and put assessment in here, put those things in there, save, close. You can put all kinds of notes in here, and you'll have various activities where you will need to add notes. If it's an infant and you want to put an APGAR score in, there's a template for that. If you need to put, like, she has toxicology results. She has her emergency room admit note. She was alcohol involved, single car, motor vehicle accident, altered level of consciousness, multiple acts, 30 years old. She was drunk. Police arrived at the scene, found her pinned in the vehicle, semi-conscious, smelling of alcohol, marijuana. There you go. So there's her whole ER admit note, where the doctor dictated and put all of that stuff in there. And then you'll be able to see my little SOAP note that I put in there just to give you an example of how to enter a note. Alright, so after you're done with notes on the overview, I think that's it for overview. So we got through alerts. We got through problems, her problem list, so a list of active problems. We got through vitals. Now on any of these, you can always add new. You can add a new alert. So say we find out that she is actually allergic to codeine. I before E except after C, right? But I think that's not true for codeine. And we know that after she becomes conscious, we find out that she's actually allergic to codeine and her symptom is anaphylaxis. And so we save that and close. And we are actually going to go back in and now this one has become inactive because we added an active allergy alert. So that's how that works. So we added this one that makes it active, so that makes this no known allergies inactive automatically, which is kind of cool. So you don't ever want to go delete anything in a medical record. You just want to keep adding to it. And if the medical record does what it's supposed to do, then it will automatically update things previous to it. Problem list, we can add new problems like we talked about there. So we say that she has These are the ICD-10 codes. So I don't even know what to give this girl. Let's give her an anal polyp. So she gets for drinking and driving. So we're going to give her an anal polyp. And we're going to say that it was removed. And unknown. And priority is... Enter her priority. I'm just going to put NA because I don't even know how to prioritize that right now. So I'm going to save that, and there we go. So now when we look at her problems, I better change that. That's not an admit problem, that priority, that is an outpatient priority. So let me save that. Okay. So now when we go look at her problems, we're good. Vitals, we talked about that. Pain, and then you can click on the tabs from within the vitals. Temperature, pulse, respiration, blood pressure, and O2 stats, pain, the CRIAS scale. If they are nonverbal, the pain assessment scale for nonverbal, the wrong Baker-Faces scale, and the intake output. You won't do a whole lot with I&O, but it's there if you need it. Glucose, quick survey. Orders, we talked about that. I put one in there. Meds. Here's meds. You can administer meds here. Medical record number or scan it. Notes. Care plans. She doesn't have any care plans. You guys won't do a whole lot of care planning. MAs don't do a ton of care planning because we don't work floor units in the hospitals very often, so we don't mess with care planning too much, so you won't use this tab a whole lot. Labs. We talked about that. Here's hers. She's got all of these labs in here. Not everybody will have them, but she has all of them, and actually most patients will have these in here for their pre-existing like metrics that you can populate. And then for pharmacy, you can also populate her patient profile here. You can edit her patient profile. Actually, for hers, I don't think you can. Her med profile is a nice little snapshot of what her meds she's currently taking. Any processing prescriptions, that's more for pharmacy students who use this software. Inpatient processing is more for nursing students who are doing inpatient rotations. So not really us, but it's a nice little overview if you're looking for things there. And that's pretty much it. So there's kind of an idea of how these tabs work over here. The biggest ones that we'll use are in health. And so the ones that are in health, with the exception of care plans, will be the ones that you will work in the most. And so kind of pay attention to those. All right, I'll see you guys tomorrow.